At least they would have allowed universities to be back. One viewer's interpretation of what has happened, that's his view. Oseno Mark says the how and not the when schools should be open should be the focus in dealing with the reopening of schools. A school like Muiki, primary in Kiambu, has a long way to meet the required protocols for reopening. All right. I think we have one or two more. Cheza KE, you say with 2% fatality rate, 93% no symptoms, why not focus on medical care for the few who need it and let the rest of the population live with the virus? Which data are we using? Why are we still comparing with Europe, whose populace is different? I'll be looking at SMSs as well a bit later on. But let's get into our discussion. A bit earlier on, you saw me talking to Wilson Sosion. But let's bring in Dr. Githinji Gitahi, get his reaction. Daktari, thank you for making time for us on the Monday report. Just to recap a few of the measures, the curfew extended for another 60 days, 11 p.m. to 4 a.m. We know that bars, eateries can continue or start serving alcohol from tomorrow up until 10 p.m. We know that the capacity at funerals and weddings can be increased to about 200 as well. What is your assessment, your thoughts on some of those measures announced by the President today, Daktari?
Thanks, Wahiga. And my view is that it is a fairly cautious strategy or reopening as is expected, because as the President made very clear, we are not out of the woods. What we are seeing may just be the flattening of the first curve, which is related, by the way, to only five counties: Nairobi, Kajiado, Kiambu, Machakos, and Mombasa. Those are the ones contributing 80% of the curve we are seeing now. So we do not know about the other 42 counties, and therefore it is necessary to reopen with caution, so that if things get out of hand, you can actually take back a few steps to continue preparing. So I would say I am not disappointed. It is actually the right thing to do, to be cautious.
Help Kenyans understand this, and many are asking tonight, what's the point of a 5-hour curfew, 11 p.m. to 4 a.m.? Is there scientific data, to kind of back that kind of a decision?
You see, the thing that we've talked about on this platform before, and we need to remember, is that the transmission of the virus is highest risk when the following conditions are together. One, that people are in closed spaces. Two, that there is crowding in those closed spaces. Three, that there is contact in those places, especially when that contact is from people from multiple households. Because we know that the COVID-19 actually operates in clusters. So you see clusters of households or clusters of communities. And therefore, when you get multiple people from different households coming together, that increases the risk. And the final element or dimension is time. That if I meet you and you're positive and I meet you for 15 minutes, versus if I meet you and you're positive and I meet you for 6 hours, the risk for infection of 6 hours is so much higher than a contact of 15 minutes or 1 hour or 2 hours. So all these factors coming together inform the decisions on how long and also the number of people that need to be in one particular place at a time.
Okay, Doctor, thank you for helping us just understand that a bit better. And of course, we also have Sosion on the line. We were talking matters education with him before you came on. And before I go to Sosion, Dr. I must give you a chance to weigh in on this whole education discussion. Many expected the announcement of gradual reopening of education institutions today. That did not happen. Now, you head AMREF across Africa. I'm sure you're hearing, you've been studying what's happening in other countries in regards to the reopening of institutions. We know that places like Tunisia, Uganda, Tanzania, for all intents and purposes, there's been a sort of return to new normalcy when it comes to the education sector. What is your take on where Kenya is right now in regards to this whole discussion, and what lessons can we learn from other countries?
So what I would like to say, number one, is we saw South Africa reopen schools and close them at some point. So we have to be cautious that at every decision you make is a balance between risk and benefit. There is no risk-free decision that any government can take. And even the governments you've seen making decisions to reopen schools, it's a risk versus benefit. We know, fact one, that children benefit by being in school. So in-person schooling, there's no debate that that is what a child needs. The second thing we know is that when the children go for in-person schooling, the risk profile of infection increases drastically, especially where you know that you cannot maintain the necessary public health measures. We know how crowded the schools are. We know that we don't have water and soap in all our schools. We know that young children will not obey mask wearing. So we have to ask ourselves those questions. Maybe just to tell you a quick statistic before Sosion comes in. We have talked a lot about the risk of children, and yes, we know the risk is low. But are Kenyans aware that children of school-going age have only contributed to 10% of our total cases? When we have 38,000, only about 3,600 have been children under 19. Why? Because they are not mobile. We all know that our children are at home. We don't allow them to go. They need permission to go. They are basically at home. So the rates of infection have been very low. Out of those, the death rate has been maybe about 20 or so. So what if this 3,500 was 350,000? What would happen? So we also need to look at this and extrapolate the risk. And therefore, that is why, I have said before, the most important thing about schools is not when, it is the how. Just like the President said, it's not about when are we opening, it's how prepared are we, so that we can minimize the risk. We'll never eliminate it, minimize it.
Okay, not when, but how. And that's a question I want to immediately throw to Sosion. Sosion, what does that how look like? Let's get into the details of that. In your view, what how would satisfy you that it's time to reopen?
I think this is not a new debate on how schools should reopen. And I remember in the month of June, we had a very heated debate on whether schools should reopen in June or not. And that is the time when the positivity rate was at 14%. That was actually astronomically high. And we all agreed, and we have agreed, the protocol measures of the World Health Organization must be adhered to. And 2 weeks before reopening, teachers should actually report so that they really prepare. And I think very largely, we have not, for the entire period of 9 months, we have not really put in place practical measures to ready the schools for reopening. Today, the teachers have reported, and they're giving us the different case scenarios of the different schools, the level of preparedness, and it is common knowledge. There is a checklist. There must be, number one, clean running water, and with sufficient soap and sanitizers to cover all the learners at all times. And there must be sufficient personal protective equipment, particularly the mask. And those are very key issues among many other issues. Schools must be connected to health facilities so that in case of reporting, in case of any reported case or suspected case that can be reported, there must be thermogans in every school. There must be COVID-19 committee in every school. And these are things in the wisdom of the stakeholders committee that we agreed that teachers should report early enough so that they can go through the guidelines and assess what the school is missing, what is in place, so that they can prepare. In fact, all these matters must be devolved to every individual school, and the necessary preparations are set in motion in terms of preparation of teachers, in terms of preparations of boards of management, in terms of procurement, because many schools do not have water. And in the event that there is no water in any school, then who will provide the water? Those are issues those are the necessary preparations. The how is to ensure that the requirements and recommendations of the World Health Organization are in place so that the protocols of the Ministry of Health can be enforced throughout the period of learning. And these are very important, very largely because it is difficult to enforce social distance in learning institutions. This has been experienced world over. Even if you reduce the class sizes, even if you spread out teaching and learning to take place outside classrooms, there are certain obvious things that may not be fully achieved. But then there has to be a balance. Issues like availing masks to every learner and availing sanitizers and training teachers sufficiently so that they can enforce all these practices and procedures.
Secretary,
and also,
I want to come in on that note.
The necessary skills for psychosocial support for learners. Those are the preparations. That is the how.
Secretary, I think you've given us quite a detailed description of the how and what needs to have been put in place. But many would be asking tonight, if we haven't enacted a lot of these measures over the last 6 months, what are the chances that we can get all those right in 2 weeks, a month, 2 months before the end of the year?
Yes, in 2 weeks or 2 months or whatever the time. But
what are the chances?
Must begin somewhere. That one I cannot predict. It's all about resources. And this is where we come in. And this is what principals and head teachers are really pleading, that schools will need to receive their normal capitation almost immediately, because some of these resources is about procuring by the school authorities. It's about liaising with the Council of Governors, because largely health is devolved. If we shall need thermocans, if we shall need health facilities to be connected to schools, is a logistical issue. If it is about mapping out schools that do not have water, so that water is availed, since water is largely also devolved to the county government, all government organs will work interactively. And this is what was said today in the conference, that what has helped Kenya to succeed in flattening the curve and in managing COVID is leadership. It is still leadership that is required. And that is why we requested for teachers to resume early enough, as early as today, even before the pronouncement is made, so that they can provide the leadership. And once you provide the leadership, once leadership is provided, the necessary requirements from school to school shall be identified and procured. And we agreed. This is not a one-off event that you can fix it all at once. And children will be, school learners will be reporting in phases. And the first cohort will guide the school leadership. That is the heads and the teachers and the COVID committee in identifying the gaps and fix them appropriately before allowing more learners. It has to be done in a very elaborate and scientific manner as well. So even if today we sit and say, okay, let us still discuss and debate the how. We shall debate the how until next year. And when it gets to January, we'll still find we shall not have done many things. Let us bite the bullet and begin the preparation now. Teachers are already in school, and in our own belief as teachers, we should continue. Teachers should remain in school.
Let me come in there. Secretary, if you can allow me to, please allow me to come in there, because I want to pick up on something you've said. So I wouldn't be wrong tonight for saying it is quite possible that the first cohort of learners will actually go back to school at some point next year. What does that mean for the school calendar? When and how long would it take to normalize a calendar that begins in January or March? Briefly tell me this.
Yes, all this, if you look at the entire world, 2 billion children are out of school, and many countries are struggling to bring back learners. And the context of every country will vary. We have our own context as a country. And the reopening of school in Kenya from the leadership perspective has to be done very empirically, without mistakes of hurrying, so that there can be an upsurge or another wave of infection that will spiral out of control. But then our concern is, and it's very clear from the president's pronouncement, that we must maintain the protocol measures in place. It is now time to work on the how, very quickly, fast, and as practical as ensure that all these measures are in place, so that then we can readmit students in phases, and the practical recovery strategy, which we still believe will work, is to work innovatively to ensure that the lost time, which was precisely 24 teaching learning weeks can be recovered over time so that exams can be done, the 2020 exams can be done at an appropriate time, so that by the end of 2021, the lost curriculum time for 2020 and 2021 shall have been recovered. We still believe this will be done.
Okay.
And the president did not close the window. The president emphasized that we should all work on the how until we have agreed on the how.
Okay.
Then schools can resume. And I believe if the Ministry of Education, the Ministry of Health, and the Council of Governors and Teacher Service Commission can work together aggressively and check and prepare every school, and every school really passes the test.
Yes.
Resumption of learning can happen at an appropriate time.
Okay.
The World Health
Thank you,
Organization and UNESCO gives a period of 2 weeks.
Okay.
If that is done, then we'll have sufficient time to start off and get all the children back to school gradually without running the risk of another spiral of a disease. And of course, ensuring that learners are safe and teachers are safe.
Okay, thank you. And I think, thank you for putting that into perspective. Let's take a look at the broader picture of the measures that were announced by the president today. And let me bring in Dr. Gitahi for this. Dr. Gitahi, if you look at your Twitter right now, I know you are quite active on social media as well. The hashtag booze is back. Alcohol is back. Is trending. It's actually at number 2. It was at number 1 a couple of minutes ago. 6,474 tweets. A section of Kenyans going online to talk about how eagerly they are waiting for tomorrow to be able to visit their favorite bars, eateries, etc., and partake in their favorite drink. Now, you on previous shows on this program have come to talk about the dangers, and you've actually talked about it right now. What is your message to the Kenyans tonight who are saying we can't wait for tomorrow to go back to our social venues because it looks like life is back to normal?
Well, let me give some very quick statistics, because I think data speaks a lot.
Okay.
If the one trend that Kenyans haven't actually noticed is that as our infections announced or confirmed are reducing, mortality numbers are not reducing. In fact, in the last 14, 15 days, if I was to look at 14 days of September, the total numbers of infections announced at around 2,000, and the total number of deaths are 76. So when you divide that, you'll see that our mortality rate or our case fatality rate in the last 14 days is 3%. So when you're talking about the case fatality being 1.9%, you are referring to a total load from March to now, which combines all the numbers. But actually, when you look in the recent 2 weeks, the last 2 weeks have contributed more than 10% of our total deaths since the COVID started. So we are saying that we are not out of the woods. The numbers may be low, and we know there are reasons why the numbers may be low. And I can give some of the ones I think are. One is that our testing is low. Secondly, our contact tracing is low, it's not optimal. Our contact tracing was much better in the early days of March, April, and May than it is right now. And that's the truth. And part of the reason for this contact tracing is because the testing response is not good enough, and therefore people have to wait for 10, sometimes 7, 10 days for the results from Nairobi if you're in a rural county, and therefore within that time you don't even remember who you met, or maybe even the contact person has gone back home. So that's the challenge. The thing we need to realize is the last 2 weeks have contributed 10% of all our deaths since COVID started. That just tells you we are not out of the woods. So my message to you is it doesn't matter whether the bars are open. Only go there if it's absolutely necessary. Don't go there just because they are open. The announcement to open does not chase the virus away. Don't put yourself at risk.
So, Dr. Hari, it then makes me wonder, what were your thoughts when you saw pictures this week, and I don't know if you saw some of them, from Bungoma, of crowds gathered in one location, or Mombasa during the celebration of World Tourism Day? That seemed to send a picture to some Kenyans that we flattened the curve. The COVID-19 concern is over, done and dusted. You sound like you don't hold the same view.
No, I don't. And the view I hold is that, and I said this earlier, that if you look at our total cases, about 80% of them are 5 counties. And those counties are clustered around Nairobi and then Mombasa. The other counties that we can call lag counties that got their first cases much later may have a much slower pandemic because their movement is also lower. Remember that the faster the population is, the faster the transmission of the virus. That's why we saw it more in South Africa, Egypt, Algeria, then countries like Kenya, Uganda. Others are going to lag behind a bit depending on their mobility index. So the counties that came later have also lower mobility. So we're expecting they are going to also start peaking at their own time. The challenge is, are we going to notice their peaking if we are not doing contact tracing? So that is my worry, that we may get a second wave, which is only noticed by hospitalizations and noticed by mortality, not noticed by the number of laboratory tests, because we've seen that kind of come down a bit. So we need to be cautious. And when I see people aggregating like that, especially when the public health measures or advice is still not to congregate, it just takes me back to our behavior in the country, that the same reason why we jump traffic lights, the same reason why we congregate like that, because we think that we can only act when there is supervision, when there is police, and this is something you say consistently, we need community ownership. We need the people to go out and say, this is wrong, we'll not do this. You don't need police people there.
Dr. Arian, I'll be taking some videos from Kenyans who've sent them in. They have questions for you and Sosion. But my last question to you, and the bigger picture of where Africa is in regards to COVID-19. A headline, a story about the WHO back in April said that Africa was slated to be the next COVID-19 epicenter. They predicted that things were going to go from bad to worse in Africa. That was back in April. Now, recently, we saw a different publication quoting WHO saying and applauding Africa, praising Africa for its response as the virus cases decline. What happened across the African continent? Because the predictions clearly were wrong.
So I would say there are several factors. Mm-hmm. Number one is that some of the initial projections of, especially, you see, there are two different projections. The first projection is number of people infected. That will continue. That will continue. Children, adults will get infected. The child, and you will know, some you will know. In fact, the last study by Kemri was saying maybe up to 6% of the continent or of the country in Kenya is infected already. That's a high number. 8% of 50, you're talking 4-5 million people. Mm-hmm. In Nairobi, they were saying is maybe almost 9% based on blood samples collected in the blood collection process. So infection is not really the issue. The issue is how many of those infected get moderate to critical disease, and therefore they require hospitalization and require oxygen and ICU. Now we know that the constant risk has been age, it has been hypertension, it has been diabetes, it has been cancer, and maybe chronic lung disease. What happened is that those projections had actually copy-pasted from Europe and then had actually added in the possibility that immunosuppression by HIV and malaria and TB would increase the risk further in Africa. But there has been no evidence that people with HIV have a higher risk than people who are above 60 years. Actually, the risk is slightly higher than a person who doesn't have HIV, but it's not significantly different. So those projections had assumptions which have not come through. And the other one is obviously that we have a very young population. Our population, half our population is below 19 years, and in some countries like Italy, a quarter of the population is above 65 years. So those age demographics are the ones that have painted a different picture, but they were originally assumptions in the models that we were given early, and now we know that those assumptions did not come true. But that doesn't mean that we still don't have a high mortality. 36,000 people lost in Africa is not a small number. And we need to worry about, is it likely that when the disease goes to the rural areas, that where the elderly people are, that we might see a higher case fatality? I am not convinced that actually the curve has flattened. I'm convinced that the urban curve has flattened. The rural curve is yet to be seen. Very interesting. Urban curve has flattened, but rural curve not yet. I think some of these Western publications should contact you because some of the articles that we saw out there, many felt were quite ridiculous. Nevertheless, let's get the views of Kenyans right now. These are some of the questions they have for you. And Wilson, Sosion, Sekjen, Nat, I hope, Sosion, you're still on the line. Great, I see you there. Let's play the first clip and listen to that question or comment.
Okay, from today's president's speech, it is a clear indication that there was no clear communication between the CS cabinet, Professor George Magoha, and the president himself. That has also brought a great surprise and dilemma to students, parents, teachers who were told earlier to prepare for the reopening of school. It has also brought some confusion even to universities, like most universities have sent a timetable showing on how to open schools.
Thank you, Mr. Waiga. I would like to ask anyone who advised the president about the curfew. Does it mean that COVID-19 is being transmitted from one person to the other at night?
All right. Let's get some short comments there. Let's start with you, SecGen. Someone has asked about, could there have been a breakdown in communication between the Ministry of Education, or better yet, even, the task force, that the COVID-19 Education Emergency Response Committee, and, the team that, advised the president, even as he gave that speech today, because it seems confusion, actually, is a word that's been used quite a bit to explain what has come out in regards to education. Sosion, can you shed a bit of light on that?
And I think Kenyans themselves are confused, and
it's the Kenyans who are confused.
Specific rigid expectation, which is very, very wrong. The COVID-19 Education Committee worked, and it reported to the cabinet secretary, who made a proposal to another larger committee, and eventually the leadership of COVID-19 in the country is vested in the President of the Republic, who receives advice, and he has made pronouncements. So for us to speculate that there was confusion from point A to point B is wrong. We made it very clearly from the beginning, and the CS made it very clear that the president will give direction, and the president has given direction, and he has made the emphasis on the how, and has made it very clear that we shall only reopen once we agree on the how, because the health of our children is important, and that agrees with the views of all the Kenyans, with the views of the minister, and with the views of all of us. And we have been guided to focus on the how. Very initially, when it was proposed that schools would reopen in January, there was a lot of public pressure. We saw media campaign that there were other alternatives that could be used to promote learners, that it was too early for us to think about reopening schools in January. But when there were indicators that schools might open early because the curve is flattening, and Dr. Gitahi is telling us it's the upper curve, we are not sure about the rural curve, and the president has given a caution that there can be another wave of this disease. And it is very clear from data of experts that this wave can resume if schools are reopened without proper planning. So to me, I don't see any confusion. The whole of this process of COVID-19 and the trend in this country, reopening the country, relaxing the conditions, rest with the medical experts' advice. And you cannot just walk in and open schools carelessly. Okay. If medics tell us, hey, we are risking another wave, let us do it more cautiously. Let us focus on the how. And it has been pronounced by the president, who also is the chair of the National Security Committee. Who are we as Kenyans to debate? It is for us to focus then on the how and see what we need to do and prepare for any eventual reopening of schools. There were no time limits that were given. And in fact, the directive was given to the Minister for Education to prepare a term calendar. And that thing, he will not be doing it in isolation. He will also be consulting the medic. So I think there's no confusion here. It is a matter of us moving forward, understanding the situation, and being cautious. The curfew is extended for 60 days, but it's calibrated to between 11 and 4. So it is 4 a.m. in the morning. So there is no confusion here. Leadership has been offered. It's only incumbent upon all of us to comply with the directive that has been given. And from the domestic viewpoint where I sit, it is all of us now to focus on the how, which is very critical. Because the question is, we must avail a mask for every learner. We must avail sanitizers in every learning institution. We must prepare teachers. We must prepare parents And we must link schools with the medical facilities. We must ensure that schools are actually ready and safe both for teachers and learners. So where is the confusion here?
Okay,
there is
thank
no
you.
Confusion.
I think
the question of the how is important. And
yes, the question of the how is very important. Dr. Gitahi, I'll give you a chance to respond to that one question. But I think let's take another two more so that Daktari, I give you a chance to respond to more than one question. Let's see what else Kenyans have to ask tonight.
The safety of the children and teachers is paramount. Any debate on a reopening of schools should be pushed to 2021. To be frank, and everyone knows it, is that schools shall not, will not, must not, and cannot open this year if we have the goodwill to safeguard the safety of our teachers and our students.
I think that statement is untimely. It is satirical. It exposes some weakness in the Ministry of Education as a ministry that had not planned.
My name is Bran. It is clear that over 60% of our population are youth. So it is so sad to open the bars and yet our students are still outside there, not doing research, no studying. So I would ask the government to come up with a clear formula in which our students and our pupils can be back to school, even in shifts.
All right, a clear thread. Lots of Kenyans concerned about back to school. Some have described the communication so far as untimely. Someone used even the word satirical. Others have asked, or another has asked for a clear formula from the government on what back to school would look like. And an initial question, which I'll start with for you, Dr. Gitahi, was someone asked, I guess tongue-in-cheek, is COVID-19 transmitted at night? And that's why the curfew still remains in force between 11 p.m. and 4 a.m. You touched on it a bit earlier, but let me give you a chance to respond to some of the questions that have been asked, Daktari.
I think it's an important question because people need to understand that it's not about the night or the time. It's about the fact that the night presents opportunities that increase the risk of transmission. Because if people are socializing in clubs, remember they're indoors, they're crowded, there is contact, and in most cases, they're speaking loudly over the speaker in the club. And therefore the aerosols, the circulation, the airborne transmission, the contact, this is the issue. The issue is not about night or day. And during the day, most people are at home and they're at work, and therefore there are more controlled conditions that reduce the risk of transmission. So that's what I would say. But I would like to talk a little about, to just mention something about schools that Kenyans also need to realize. First is we have established that though the risk in children is low, it is still a risk. Nobody wants to lose their child if there were no measures taken to protect their lives. And every life is precious. Even one child lost is one child too many. We must remember that. So this is why preparedness should be the focus rather than the date. Remember also that unlike in many countries elsewhere, our children travel kilometers to go to school, whether they're in primary school or secondary, or they travel many kilometers, meaning that you're actually contacting now from different households and communities are now bringing them together. The fact that you have more than one household, more than 5 households getting together increases the chance of infection. The final point to remember is that many students live in dormitories. You've seen what happened in Singapore and other places. When people live together in a crowded place for long hours and they sleep there, the risk of infection is higher. So we need to put all these in perspective as Sosion and Magoa and CS Magoa and others prepare, and the parents must be included and students must be included in this conversation. We need to put all these factors in place.
Interesting points that you've put across. I think we can get one or two more, then I allow Sosion to really weigh in on them, getting a lot of questions about safety of children at home and so forth. But let's hear what one or two other Kenyans had to say.
For successful school reopening, it requires plans and policies that support evidence-informed measures like physical distancing and washing, use of masks, and environmental cleaning. That is my take on possible reopening of schools.
We want to say that President Uhuru Kenyatta was wrongly advised. It is time to go back to classes. Waiga, remember right now, pregnancy rate is increasing. We want our students to go back to school. And that is our final say. There is nothing about fearing corona. Yes, corona, it is real, but we shall take precautions and measures necessary.
And I wonder why the president did not reveal the exact date when students are supposed to report back to school.
Okay, Secretary, I hope you're hearing some of those questions. Lots of questions, more than answers, it seems, around this whole debate. And a measure of frustration from Kenyans. One asking, why couldn't we just get the date and know the way forward? Another one saying, we really needed to go back to school. And you're hearing those voices. Sosion, talk to me about the balancing act that education officials have had to sort of undertake at a time like this. And also, if you can just shed light a little bit on that education committee, the emergency response, and what their views were on issues like increasing the number of teachers, if it's possible, and what would happen if there was COVID-19 in a school, for example. What sort of protocols had been proposed by the committee that I believe, the deliberations you were privy to?
The issue of reopening of schools really is taking an emotive direction, but would like to caution Kenyans. It is in their best interest that there is leadership, and leadership has been shown, and we have been guided, and really, indeed, we must abide by it. Number one view has talked about proper plans and policies in place needed. This is what we are executing, and these plans and policies are subject to review and guidance by other organs in government. The direction has been given today that let's focus on the how. Then once we are agreed, then really we can resume schools. This means, the how means it's about the plans that are in place and the policies, and of course a lot of guidelines that has been released to schools. And as of today, teachers are trying to understand the guidelines. There are more staff meetings tomorrow and other days. And there is no day, I would like to caution, there is no day the president can be misadvised. The president is advised by a strong team of COVID-19 response and a national security committee. And of course, the pandemic is a great national security threat that the president is advised very rightly, and he can make any pronouncement anytime in the best interest of the country. And so if really we had exaggerated expectations of hearing some announcement about a certain date when schools should reopen, and it was never announced, then we cannot begin blaming the president's office. I agree. Children have suffered at home, and our analysis, even as teachers across the continent, is that children are suffering a lot in the absence of resumption of schools, and there is a very likelihood that the enrollment rate will even drop when schools resume, and this is a great risk, and we have agreed. Schools are safer for children than home. But then the big question, the elephant in the room, is the how. How do we make schools safe? And it would have been very wrong to pronounce a date that schools open on 8th, 9th, or whichever date without confirming the proper preparations. So it is the preparation that will determine the date.
Okay.
If preparations are done this week, are conducted this week, and concluded very successfully, then schools can resume immediately. And for us as teachers, we think it is time the country rally its forces and prepare schools adequately so that there is early resumption if we have to catch up with the curriculum that has been lost. Whether there were recommendations by the COVID committee, of course, there were a wide range of recommendations of by the COVID committee. And we were cautioned properly that there is highly likely going to be an outbreak or spike of the disease, but in localized spots. And in such circumstances, as has been practiced in other civilizations, is that if an outbreak is localized, then schools could only close in that locality.
Okay.
And if there is an outbreak in any institution, and that is why psychosocial support is necessary in terms of preparing the pedagogy and skills of teachers to handle learners. In case of getting 1 or 2 learners who are likely infected, how do you handle such learners without causing a lot of issues? And particularly if there are such cases, it was agreed that they must be linked to the nearest medical facilities and reported promptly. So I think as a country, we've done a lot in terms of theoretical mapping out of developing framework of preparation. And it's just a matter of now, let us move full throttle and prepare for reopening of schools, so that by the time people question the how, we'll have answers in every institution that everybody can see. And we think with the curve flattening, something little needs to be done and fixed and prepare schools, and we'll be good to go. We are prepared as teachers to resume once the how is confirmed and agreed by all of us and permission granted.
Okay, thank you, Sekjen, for that. It seems my time is pretty much done, but I want to get 2 more views from Kenyans in this sort of virtual town hall format that we have here tonight on the Monday Report. Let's hear those last 2 views, and then we get final comments from my panelists. Let's play the first one.
And just because numbers are declining doesn't mean that it is safe to reopen. And before we start talking about reopening schools, let's first discuss the measures that have been put in place to ensure that schools are safe. Let's first ensure that these schools are safe, then we start talking about when do we resume studies.
While I think it's a good idea that the president has eased some of the measures, I would also have expected the president to give more details on the education sector. We expected a phased reopening. Teachers were called back to school, but it then seems that we are being taken back and forth. What's the move, and what are they planning?
All right, Kenyans have had their say. Dr. Gitahi, I want to give you the first chance to give your final comment on this. And even as you possibly reflect on what has been asked by Kenyans, one question that rings in my mind tonight is that about 2 or 3 weeks ago, we began to see the return of political rallies and Kenyans gathering in different venues to hear from their political leaders. This weekend, we saw what looked like a return to social gatherings as well. We're in September, heading into October, getting closer to the festive season of December. We expect to hear a lot of social pressure to meet again, whether it's weddings and other functions as well. But you are telling Kenyans tonight that even as that happens, even as the social pressure to congregate continues, you need to stay at home, you need to stay safe, you need to keep wearing your mask. There is going to be a struggle in that at this time, Daktari. How can Kenyans navigate that with the information that you're giving, but with also the realities that lots of opening up is happening in the economy? Daktari, it seems you've muted your mic.
Sorry, Wahiga.
We can hear you now.
Yeah. Okay, good. This is a personal decision that Kenyans need to make, because public health regulations are implemented so that you can reduce the risk of people getting infected. It's the same way, as I said, that we put traffic lights so that people are safe. But we still see people jumping the traffic lights and putting their lives at risk. So what we are saying is that even as these things reopen, my personal message to every Kenyan is, remember that the danger of COVID-19 is still there, and therefore take the measures you'd want to take to protect yourself and your loved ones. Don't take the measures simply because the government said so. Take the measures you need to take to protect you and your loved ones. The next thing is on schools, and my urge to Sosion and the people who are planning the school reopening need to also pay attention to the resistance by parents to take their children to school. You can announce a date, and the parents, because they are in charge of the lives of their children, they can decide 50% of them can decide they won't come to school. So there is also some work to be done by actually bringing in stakeholders like parents and having this conversation. And even when as we prepare, allaying the fear so that the parents, when we reopen, are ready to bring their children to school. Otherwise, it will beat the purpose to say we've opened, but 50% of parents say, I am not sure that that school is safe. So that also needs to be paid attention to, because it's a personal decision for your child, it's a personal decision for you. Remember, looking at the death numbers, it tells you clearly the virus is still with us. Somebody has asked a question, Wahiga, if you allow me, it's just 10 seconds. I saw it on Twitter, that why is it that the countries that are not testing don't have deaths? The countries that are not testing have deaths, but if you're not testing, then you say the death was caused by a pneumonia. You'll never say it's COVID. So even those countries that are not testing, they're still having COVID deaths, but because they're not testing, they won't be listed as COVID deaths. They'll be listed as deaths, natural death at home, death from pneumonia, or collapse, or heart attack, whatever it is. So remember that even countries not testing are still having COVID cases going on in their countries. Take care of yourself. Take care of yourself, my friends.
A strong word to wrap this up, Dr. But let me ask you one more personal responsibility question, which you can answer in 10 seconds. You're a leader in this society. Let's say, for discussion's sake, you get an invitation to attend a ceremony somewhere up country in your village, and you know that roughly the last time there was a ceremony like that, about 400 or 500 people attended. Now, the people back home really want you to attend, Daktari. You're not sure if people will wear masks. You're not sure if there'll be social distancing. What's your response?
My response is that I will not attend it. I will not attend, and my advice will be, and many people have come to me and I've advised them, take the measures you take to protect your loved one and yourself. And therefore, I will not attend something that I think would put, it's not about government regulations, anything that would put risk of people at risk and me at risk, I will not attend it. That's what I will do. So if I show up and the numbers are big and there's no social distancing, people are not wearing masks, I am free to actually leave. That's what I will do.
Okay, and I'm sure that's something that a lot of Kenyans will be grappling with over the days to come. And for you, Secten, let me give you a chance to give your final word. A lot of questions were being asked by Kenyans about education, but in 1 minute, how would you summarize this discussion for us tonight?
Yeah, indeed, proper measures have to be put in place to ensure that schools are safe to learners and teachers and workers. That is not in doubt. And the details of reopening, these are being worked out at school level and through guidelines at the ministry. And this is work in progress. And a directive has been given to the CS. And other issue, there's the question of political rallies resuming. And this brings the issue of social distancing. In schools, this one Kenyans should prepare. It is going to be very difficult to enforce social distancing. But to compromise social distancing, the issue of masks and other protocol measures must really be put in place. And we have seen rallies coming up and the people meeting, and this is a new normal. So therefore, where social distancing may not be fully enforced or is not practical, then we must ensure that masks are fully in place. And this is probably what schools will have to address. And then very lastly, parent resistance. This is a disease we have in this country at the moment. Because if we open schools and parents really do not release their children to school, that will be a disaster. But if schools we shall confirm that schools are safe, and we shall all have agreed, anybody retaining a child at home or obstructing a child from attending schools will be in gross violation of the law. But I think generally what we need to do here is to reassure all the parents. The necessary thing and the step and the pronouncement of the president is to invest our efforts, energies on the how. And this we should be able to dispense within a very short time so that schools are safe. And therefore we urge parents to be very positive. Don't tell us that you don't have fees, that you are not prepared, your mind was set for January. We are also eager as teachers to try and catch up with the content that has been lost and to ensure that no child actually repeats and that learners are able to transit within a short time to the next level. And so that by the end of 2021, that was our focus, that will bring the curriculum back to normalcy. And I still believe that window of opportunity is open, and therefore we will need the full and unwavering support of parents. And once schools are pronounced for reopening, please bring all the children, not some children, all the children. We want all boys and girls in school, and hopefully with the measures in place, schools will not be centers and spots of spike of the disease. They will be very safe to teachers and learners.
Sec Gen, I know parents were waiting to hear that last word from you, and you've wrapped up with that appeal that when schools reopen, may all the pupils and students report to those institutions. Thank you so much, the both of you, for taking your time to be part of this discussion. I've actually picked up new lingo today. Urban curve, possibly flattening. Rural curve, still a long way to go. And this is what some of you are saying online. Kangwana Dennis says, Daktari has nailed it. Will the parents be ready to take their children back to school? This is a serious issue that should be considered when addressing the issue of school reopening. And I saw one more tweet here. Why didn't the ministry take time to train teachers on CBC? Would this have been a good chance to transition all learners to that new system? And Engineer Mohammed Tache Dida says, COVID-19 has put us truly in unprecedented times. The future has never been more uncertain. Even with declining infection rates, some restrictions and precautions remain necessary, but the prevailing trend and global public health practices must be the basis of our education. One last question from Rachel Osendo. This one I'll ask to my director, Robert, who's listening in. She's asking, why are there no ladies calling in? Okay, that's an interesting. We don't know. We put the alert on social media and everywhere, and it's the gents who messaged in. I'll be back tomorrow to do Newsnight. Rachel, let's start with you. Send us your feedback on that particular show. We do this every Monday, so I don't know why today we had a lot more men than women, and I know women really had also their views to share on this discussion. Thank you to each of my guests for joining us for this discussion, and to Kenyans who watch from different parts of the country and the world, thank you for tuning in as well. On behalf of the whole team that's made this show possible, Director Robert, the crew here in studio, and other parts as well, we say thank you, because without you this show would not have been possible. I can't mention the whole crew. Some of them want me to do that. Listen, it's 11 o'clock. We need to get out of here. All I'll say is Yulan Zale was our sign language interpreter. I am Wahiga Mwaura, standing in for Trevor Ombija. Have a good night. Stay safe. Remember, the curve may have flattened in one part of the country, but possibly not in another. So please, let's take caution. Good night. Stay safe.